So what is functional training, or what is, functional rehabilitation? We talk about the term function a lot here in the clinic and a lot in our blogs and stuff like that. And really, I need to make a distinction between two major paradigms in the medical field. One is a little bit of a mouthful I call pathoanatomical model, and the other one is the functional model. Pathoanatomical means sort of like disease of the anatomy. And this is the major paradigm that we see in the medical field. So if you hurt your knee, you're going to go into your doctor, the specialist, the orthopedist, whoever, and they're going to talk to you, ask you questions, poke around at your knee, and then inevitably they're most likely going to shoot an X-ray or an MRI, and they're going to blame the diagnosis on the most abnormal anatomy. The problem with that is there are oceans of research showing that there's no correlation between X-ray or MRI findings and pain. Yes, I said that. That means that if you have a disc herniation, it does not mean that that disc is actually causing you pain, which is a good thing, right? If you've been told you have low back pain and you think it's because of this disc herniation, you might associate that with or think that, ooh, I can't get rid of my back pain until that disc herniation is gone, and that's not true. What needs to happen is a good functional evaluation, and you need to go to a clinic that emphasizes improving your function, not just getting you out of pain. Because when you focus on the structure, a lot of times you end up getting procedures that aren't necessary or don't need to be done. And a lot of times it just sort of misses the boat on what actually needs to be assessed. That's why we use a functional model. Unlike the pathoanatomical model, the functional model is going to emphasize function, right? So we care more about improving your overall function, and along the way we can get you pain-free. Right? We want to be using complex evaluations, thorough evaluations, multiple therapy tools so that we can not just get you out of pain, we can actually improve your function. So if you came in with a shoulder injury or low back, it's not just a game of, ooh, how quickly can we get you out of pain and then we're done. It's, okay, how fast can we get you out of pain, but then what do we need to do to improve your overall function, your squat technique, your hinging technique, lifting, running, everyday life technique, things that we need to address in the rehab process so that, again, your function can improve. And that's really the major difference between a pathoanatomical model, which is what almost everyone in the medical field is using, and the functional model, which is what we use here.